Hi, my name is Dr. Ross Hauser. Welcome to the Hauser and Esther Center here in Fort Myers, Florida. You probably recognize this beautiful lady, Esther, as she's been on another video that you did with Danielle, because Danielle was treating a lot of your body, and you have Ehlers-Danlos syndrome, so that's why you need so many body parts treated with prolotherapy. And then in the waiting room, you and I just started talking, and we agreed that you have an atlas misalignment. So you actually have it right now, an atlas misalignment. So I just wanted to make a short video on atlas misalignment. And unlike other videos that you might see on YouTube for atlas misalignment, I'm going to explain things you can do at home to hopefully align the atlas up. And I want to preface it by saying, through the graciousness of Dr. Julie Hunt, who has the Mayor Hunt Clinic. She runs that clinic with Travis, her son. That's in Clearwater, which is about 2.5 hours from here. I was able to take the courses in orthospinalogy, which is a branch of upper cervical chiropractic care, just to learn. So I learned a lot about the chiropractic management of upper cervical care or atlas care. And then in Chicagoland, where I practiced for many years, I was associated with Dr. Marshall Dickholtz and his father, who are one of the most knowledgeable people on NUCA chiropractic. So the three main branches of upper cervical chiropractic care that deal with the atlas is Atlas Orthogonal, which is Dr. Sweat out of Atlanta, that group. NUCA, which is well known, and then orthospinalogy. So, well, let me first say, do you have an upper cervical chiropractor?
I do. You sent me to him.
Okay, and then what makes you go there, and what do they do when you're there? And then we'll talk about your condition that you have today.
I have a big problem with my top vertebrae. Like I came in today and I said I had this band around my mouth going up to the back of my thing that was really tight, and then my jaw gets out of alignment. It affects my vision when it gets bad, but it's especially worse on the right side. And then I get a lot of headaches when it's like that.
When you go to the upper cervical chiropractor, what do they actually do, and then how do you feel afterwards?
Yeah, so they weigh you with feet on 2 different scales to see a little bit of if your body's off of balance, and then they check, like, are your shoulders aligned, are your hips aligned? But the chiropractic, you lay on a side, and then they push down on your atlas to try and get it.
Do they do it manually, or they have an instrument?
They do it manually.
Okay, so there's some who do it manually and some do it by instrument.
Mm-hmm.
But either way, it's very gentle.
Yes.
And then when I was taking the orthospinalogy courses, they said that I think it was something like 60% of the adjustment actually happens by how they position you on the table. Because, if you're positioned a certain way and they position you, so there's a force going up on your head. So that's like 60% of it. So they get you in exactly the right position. Then it just takes a very gentle force. Then how do you feel afterwards?
It's great. It's like all of a sudden my jaw works fine. My body is more balanced.
So in other words, when you get an upper cervical adjustment that's effective, the results are immediate. So I've had probably 4 or 5 of those in my life, and it's exactly the same. So like you feel like your spine's all off or your jaw's all off, and then you get adjusted. And if somebody has migraines or some significant symptom and you want to see is it related to the atlas, I'd really recommend doing Atlas Chiropractic. So they specialize in the atlas. And Esther, you and I talked about in the waiting room that probably the bone that's the most important in the human body as far as to be aligned is likely the atlas, because they've shown that just a little bit of malrotation of the atlas, it can block the cerebral spinal fluid. then obviously it can compress the jugular vein. When we do CT venograms or we do ultrasounds in the office, you know, almost all the compression is at the atlas. Then I asked you the question, do you feel more tension in the upper part on the right or the left? So what did you tell me?
It's much more extreme on the right.
Okay. So from the back, when you have more tension on the right, it means from the back, the atlas is turned to the right. So the atlas is turned to the right. So that means you're facing, you tend to face to the left.
Yeah, it's much easier. You're sitting on the right now, and I'm finding it hard. Like I want to turn my legs and my body instead of my head to the right.
When you did atlas adjusting, were you laying on your left side or you laying on your right side?
Some of both,
Okay.
But most of the time, they spend a lot more time me laying on my left.
Okay. So let's just talk about it because we have a lot of clues for you at home of what you can do if you have an atlas misalignment. So let's just put it together as it relates to you. So you have more tension on the right because basically when you're rotated, the muscles here like on the right are going to try to pull it back. So if you have more tension on the right, it means your atlas is out to the right, which means that you're looking left. So to rotate it back, you have to look right. You have to look right. So when you're sleeping, to look right, you have to lay on your left. So that's another clue. If you go to it's not 100%, but if you go to an upper cervical chiropractor and they always mostly have you laying on your left when they adjust you, that's how you have to lay when you're at home. Because when you're laying on your left, you know, there are going to be times during the night or whatever, you know, where you're going to rotate your head to the right. If you lay on your right, you're going to rotate your head to the left, and that's going to make the atlas misalignment actually worse, even though it's not so easy for you to look to the right. So you have to try to look to the right, look to the right, look to the right. You worked on the computer, so you work on the computer. So that means that you want to have your computer screen a little bit to the right, and you want your mouse on the right. So say you work on the computer all day, and your atlas always goes off to the left. So the atlas is, you know, turned the opposite way. You have tension on the left. That means you're looking to the right. Well, if you use your mouse on the right, that's going to be a problem. So you have to move your mouse over to the left. And just that little change, you know, it's really helped me not go out of atlas adjusting. And then, now this is an interesting question that I'm going to ask you. Prior to coming today, were you sleeping on your left side, on your back, on your right?
I start the night on my back, but my back gets too sore, so then I always go on my right side.
Yeah. See, it's the opposite. It's the opposite of what you need to do. Because it's easier, right? It's easier because you can look to the left, but you don't realize it actually is part of the causing of the problem. So that's kind of why I wanted to make this video, is just to give people some things to think about, you know, when they have an atlas misalignment. Because it's always like when you have a structural problem, you always want to think, is there anything I'm doing that's making the structural problem worse? And we spend, you know, 8 hours. If you spend 8 hours in bed, think about that. That's probably the most important position. And then when people are like, well, I can't sleep that way, blah, blah, blah. It's no, just do it for 5 minutes. And if you can't go to bed, then switch over. But you'll see that eventually you'll fall asleep, and then you're maybe scot-free, because then you're not rotating your head in a bad way for you. But you ready? You ready
Sure.
for the treatment? Okay.
Yes.